We all know what access to medicines is a global challenge, and especially for us in Ghana. And local manufacturing has been an issue, and it contributes significantly. But then there is an interface between the private and the public sector that remains largely a potential that we needed to explore. But I think that the discussions today and hereafter will take us to where we want to go. There is a health challenge in Ghana, which is poverty, and there are preventable and timely access to medicine that can really change the situation. Ghana, like most of the African countries, depend largely on imports from Asia and India, with very frequently long lead times. We still have challenges with the quality of some of these imports. We are talking about Ghana in West Africa. Just to let you know where I'm coming from, Ghana is in West Africa. These are our indices. Our under 5 mortality is at 69 compared to the African average of 127. Malaria mortality per 100,000 population is 48 compared to the African average of 94. Life expectancy at birth is 60 compared to the African average of 54. We know this slide very well because it's a slide for framework for measuring access. Quality is at the center of it, and around it we will find acceptability. Around it you find access. Around it you have affordability. And yet around it you also find something around availability. For Ghana, availability of medicines across the sectors had not been too good. You will find a lot more in the private sector rather than in the public sector. And the rural sectors are largely disadvantaged because we don't have equitable distribution of facilities. Affordability has been a challenge because if, for instance, you are treating malaria in adults, you need 1.1 days of work to be able to pay for your treatment. That is in the rural area, but in the urban area, you have to use close to 2 days' wages to be able to pay for your treatment. We are implementing a health insurance anyway, but it's not everybody. We don't have 100% coverage. And so there are some windows that will require to pay out of pocket. Again, I try to use communicable and non-communicable disease as a yardstick to measure affordability. When you come to diabetes in adults, you need 0.3 days wages to be able to pay for it in the rural area. But in the urban area, you need 0.6 days of paying wages to pay for it. For respiratory tract infections, it's even worse. You need close to 7 days wages to be able to pay for your treatment. When you come to reimbursements, you will realize that I would look at the area of reimbursement vis-a-vis our national health insurance scheme. If, for instance, you are reimbursing for ciprofloxacin, the first medicine, the ratio of the reimbursable to the international reference price is 6.84. And it can be worse for mebendazole, which is about 76.79. And all these medicines are imported medicines, and this is how much we are paying for them. For acceptability of locally produced medicines versus imported, I think that we need to do some study to begin to look at the aggressive marketing of imported products and how they affect acceptability, and then why are local manufacturers not participating in the international competitive bidding. And sometimes I'm told that poor presentation of bidding documents also affect the way their bids are accepted. And again, the perception among the populace regarding locally manufactured products. And of course, the cost of the products. For local market and manufacturing, this is a study we have looked at, a desktop review. I will not go through all the list. We have a number of medicines that are registered, about 2,490 that we looked at. And when you look at the market share of medicines produced by local manufacturers, it's just about 30%. And the question is that what is the annual growth rate of total medicines market value? For local manufacturers, it's just 6 to 8%, which is too low. And you can see how the Ministry of Health budget on medicines is close to 62,000 or 62 million US dollars. But it's unfortunate that our local manufacturers are not getting this money to work with, because, like I said, 90% of our imports are coming from Asia. I will move straight to assessment of local manufacturing studies we have done for child-specific medicines, because we realized that apart from vulnerable groups, children are a risk group that sometimes you need to pay attention to their medical needs, especially their access to medicines. We have looked at this particular group, and from the study we did, we engaged the local manufacturers to find out what they can do to help us, because take for instance zinc in treating diarrhea in children. We have it on the essential medicine list, but nobody is producing it. We can't get it to buy. So we engaged the local manufacturers, and that engagement, 2 of them took up the challenge, and they are producing zinc for us. And that, to me, is one of the reasons why we should support local manufacturing. Because diarrhea is killing our children, and we need to protect them. Poverty levels, I told you before, is the difficulty to purchase medicines. 40% of the population are earning less than the minimum wage. And of course, the trade-related intellectual property rights is also a barrier, because most of our local manufacturers do not have a fair idea what these things are. But I must say that I'm very grateful to GIZ through one of their companies, and they organized a lot of training sessions for some of us, which we benefited, which is helping us for training our capacity building in TRIPS. What has been the interest in local manufacturing? Close to 25 to 30% of the continents, our manufacturing, 70% is South Africa. The rest is shared between Nigeria, Ghana, and Kenya. The rest, either they are in the least developed countries or they don't have manufacturing capacity at all. These are issues that require urgent attention, and I keep saying that if we do not talk about them, if we have started talking about them 10 years ago, I believe we will have moved forward than we are now. What are the facilitating factors for Ghana in the way we have moved with some of our local manufacturing issues? We have a regulatory environment that is, it is not up in the skies yet, but it is there. You know that there is a regulatory, because for the zinc, it took some of the companies some time to get it through. So there is a regulatory environment. There are self-motivated local entrepreneurs, and I'm sure you experienced one of them today during your discussions. We have a UNIDO presence in the country that is gathering a lot of information. They now have a work plan that they are pursuing, working with industry, working with regulatory environment. And we have a supportive government that says that they are for the private sector. So we take their words and we are moving with them. And indeed, in 2010, I led the industry to get the government to increase we have a 33 items that are exempted from tax. We led a delegation, and that 33 has been increased to over 1,500 items, including non-finished products, especially packaging materials. And to me, that is a show of government commitment and supportiveness to help local manufacturers. Like I said, GIZ capacity building workshop in TRIPS has also helped Africa and helped Ghana. I know some of the participants on those programs have moved on. Some have moved on to become the region's representative in the TRIPS issues, and I think that is good, and I recommend GIZ for that. There is global recession. There is global recession that threatens supply of foreign aid, finance, import, and that is one of the reasons why local manufacturing should be taken seriously. The sector can support the health issues appropriately. Economic growth is likely to increase, and there will be easier continuous supply of those products. What have been the challenges? Translating policies into action. I have always told you, Nido Rep, look, we have had these plans, we have had a lot, we have had the paperwork, let's move them into action. So let's translate the policies into action. And again, the human capital in service training for industry. I have told my government that, look, you give about scholarships to about 20 or 30 people in a year to travel to somewhere to improve their skills. Why not give that, out of the 20, give 2 to local manufacturers so that they can also build capacity within their skills. And again, middle-level skills training is lacking. Financial capital is one. Technology transfer, we cannot talk too much about it. And dealing with substandard medicines. My concluding remarks, ladies and gentlemen. Only 27 of these medicines that we have listed in our essential medicines list are produced locally in the required dosage, form, and strength. The capacity of local manufacturers can produce a further 38%, but they need the wherewithal to be able to do that. They need support. They need effective partnerships. They need support to be able to move forward. And I think that given the necessary support, they will. And again, I think that we need to build capacity in local manufacturer for other ranges of innovative products, apart from the zinc I mentioned. We need to encourage investment into new and existing product lines. We need to promote the market access across the sub-region, because take Ghana, we are 24 point something million. The West African market is a bigger market. We have our big brother or big sister Nigeria also there. And so I think that there's a need for some level of partnerships that can yield results for the region. We need to promote public-private partnerships so that we can have sustainable access to medicines in the public sector. I have said, and I will say it again, in most of my talks everywhere, I said medicines are weapons. People may not agree with me, but they are weapons to fight disease. They are weapons to fight poverty. And therefore, where you keep your weapons are very important. And if your weapon is in India and China, the time you need it, they are not available to you because of the lead times. It is very important that the argument for access to medicines using local production is as relevant today as it was 10 years ago if we had started talking about it. Thank you very much, but this is Ghana, a beautiful country. Come to Akosombo.